Hello, welcome to the Community Voice. I'm Fara Sachs. My guest today is the president of Dade County Medical Association. That's DCMA. Dr. Patricia Ares-Romero. She's double board certified in psychiatry and neurology. Wow, and addiction medicine.
Yes.
Thank you so much for being here today.
My pleasure. Thank you so much for having me.
And congratulations on this wonderful undertaking that you're going to be having for the association. That is amazing.
Thank you. Thank you.
So
Very honored.
So tell me a little bit about the association, a little bit about you, and how this all came together for your life's next chapter.
Sure. So the Dade County Medical Association has been around since 1903. So imagine how many years, right? Serving our communities, serving our physicians, and advocating for patients in the community. So it's quite an honor for me to be part of this. I was first introduced to the DCMA when I was a resident at Jackson.
And how many years ago was that?
Oh my goodness, that was in 1999.
And you don't look a day over 30.
Oh, you're so sweet. That's why I love coming here. Amazing. Please have me back. So I was introduced by my mentor, Dr. Goodman, which, I cherish his mentorship all the time. So, and he told me it was so important for us to, advocate and to be part of the process of medicine, because it was changing during that time. And so, of course, you go to private practice and you start working and you kind of lose sight. And so when I was the chief medical officer over at Jackson in 2016, 2017, the director of DCMA, Angel Bosch, came to visit me, and he says, you know what, you need to get back in and get involved, right? And he was absolutely correct. And it's been wonderful ever since. And now for me to take the reins and be the president, it's quite an honor, especially since I'm only the 6th female to do so since 1903.
How does it feel?
Amazing.
Feel?
Well, first of all, I couldn't believe it, right? Because, women empowerment, so many women physicians in our community. And throughout all these years, there's only been 6 of us. So extremely honored. But yeah, kind of hard to believe.
And how many members does the association have?
I think we're about 700 to 800 members, growing. Part of a big initiative is for us to grow our membership of physicians in our community.
And I think that's important. What does that liaison look like?
So, it's quite challenging because, I always say physicians are physicians, first of all, so they're always treating to their patients. So it's kind of hard to reach them sometimes and really, express to them the importance of being part of this association, which really, talks about them, gives them a voice, especially at the table, at the legislature, when we're making decisions when it comes to medical issues. So I think that us as physicians, we've kind of lost our voice along the way just because we've been so busy, with, Medicare and Medicaid and insurance and prior authorizations and all these other things that really jam not only our patient time with our patients, but also, what is happening in our community and at the state level. So it's really giving them a voice.
And you have a private practice. You have a whole other life other than the association. Is that something you always wanted to do? I wake up one day when I'm a young kid and I just want to go into psychology, psychiatry, neurology. I want to talk about mental illness.
Yeah, no. It actually was quite interesting. I wanted to be a dancer, right? So the Miami Heat, when I graduated high school, had just come about, and they asked me to audition. So I told my mother, and my mother said, oh, absolutely not. You're not doing that. You're going to school, and then you could dance all you want after you graduate. Luckily for that, right? So, and I did, and I was actually going to be a pediatrician. That's really what I wanted to be. And so when you do your medical rotations, I was actually given hem-onc, which was oncology for children. And I would leave the rotation like heartbroken because these poor little children with cancer and hematological problems. And so I was like, I'm going to do emergency medicine, in and out, and that's what I'm going to do. But I had a professor, Dr. Penalver, which he's a dear friend today, and he was like, you were born to be a psychiatrist, when I rotated through psychiatry. And I was like, there's no way I'm telling my parents I'm going to be a psychiatrist. All the medical school, then you're not going to be a real doctor, which, by the way, we're real doctors. I swear we are. We're MDs. We rotated through everything. We know how to treat.
You had to go through the boards.
We had to go through the board, same boards as everyone else. And so, I know how to treat hypertension like I do psychiatry. But so anyway, but it's that mentality still, right? But yeah, I fell in love with it. And I fell in love of, the ability to be empathic with patients, to really listen to their stories and to really make a difference in their lives. And it's so heartening when a patient tells me, you're the first person that's ever listened to me. You're the first person that's made a difference. I mean, that just, every time, if I ever think I don't want to do this anymore, it's like those stories are like, I have to continue to do this.
And it's interesting because you've said this twice, you have wonderful mentors as you went along. So you never know who you're going to mentor along the way and downward as well.
And I love doing that. And I love mentoring women. I mean, obviously I've mentored men and women physicians in their early careers. But I love doing that because you need to empower people, right? Yes, you can, right? Yes, you can do anything you really want to do. You just have to put in the hard work, have the passion. When I hire physicians, and I've done that a lot, it's you all have the same credentials, right? Because if you would not be sitting in front of me if you didn't have pretty much the same credentials, right? So, medical school, residency, whatever we're asking for, but what do I need from you? I need for you to be passionate, to be empathic, to care about your patients, and to be flexible, because our patients need flexibility.
Interesting.
Yeah.
And now that you're at the helm as of June 1st. Presidente.
Yes. Madam President, as I tell my friends jokingly.
Oh, did you get the T-shirt and the hat? You ready to go?
I'm sending it out, yes.
Okay. So what is the current priority for advocating for the medical community at large?
Right. So, we have a lot of advocacy at the state level, which I'm very passionate about. The DCMA is very passionate about. But, we decided that this year we're going to focus on mental health and addiction. I think it's something that we're listening to it all over the news all the time. The stats of increased suicide in adolescents, increased addiction in our community, depression, anxiety, especially post-COVID. So we have that long COVID, neurological symptoms from COVID that have translated into psychiatric. So all these things that are happening in our community, I think it's really a time for us to really be in the forefront as the lead medical association in our county. And not only that, also open that to our physicians. There's a lot of stigma in our community, but there's a lot of stigma among physicians. I don't want to tell somebody I'm going through this, because how is it going to affect my livelihood? How is it going to affect my work,
Absolutely.
right? Or even my licensure, right? These kind of questions that we have. Even medical students sometimes don't want to come in to see me because they were afraid. Is this going to go on my record? And depression, anxiety can happen to anyone at any walk of life, at any time. And as a matter of fact, anxiety and depression, can happen in 1 out of 5 people in the United States every year. So it's something that's serious. So it's not only for the community to give awareness and lower the stigma, but also for our physicians, so they know they have a place that they can go and we can offer those services for them.
And I think we as patients, or a community that are patients, we don't realize that they might be going through something more than what they're, take this aspirin, you have this problem. But they are humans too that go through some really heavy duty things that have nothing whatsoever that we might not even know. So it's good that you're supporting our medical community.
Yeah. And especially we saw a lot of that during COVID, a lot of burnout from our physicians. And so, at Jackson, we were running groups and really supporting them during that time, because there was a lot of burnout, and they're seeing patients die, and our Hippocratic oath is to save our patients, to do no harm. And so it was very, very harmful for our physicians during that time.
And let's change gears and talk about the medical education that you're going to be providing.
Yeah, we're so excited about this, really providing CMEs, continued medical education to our members is so important. We are doing a lot of outreach to our universities. So we have a new association with FIU. Nice. And CHI, which is the Community Health of South Florida.
And they do so much more. Maybe you can tell a little bit about CHI.
Oh my God, they're amazing. I actually did their keynote speech because it was their 10th year anniversary of residency. So I know a lot about them. So they've been around for 10 years. They have a psychiatric residency as well as a family practice. And they did graduate some OBGYN. And they've been around for 10 years. And it's amazing what they do in the community.
And a lot of people don't know this.
Yes,
it goes on. It's just when I've learned, it's like a litiny. So just highlight a couple of things that the community might not know.
Yeah, the underserved communities. So they're really a beacon of hope for those that are really underserved in our community and can't get, the medical attention that they need. So they have physicians and they provide all sorts of services. I mean, they do dental and eye care. And it's not only psychiatry and family medicine, which is a huge part of that because they're training physicians for the future that will be serving our communities. So Absolutely. It's really them knowing about the social determinants of health and how they affect our community and our patients accessing care.
Let's talk about ethics, the standards and the guidelines for the DCMA.
Yeah, so that for us is very important, right? Because we want to make sure that the practice of medicine continues to be very ethical and has the standards by which we all should be working. And so we want to make sure that physicians are doing what's correct and what's right. And that's also part of the education, to make sure that they're up to all the laws that are in the state of Florida.
Right. And what is your first goal as the president? As you see it from June 1st to here we are, a couple of weeks into it. What's the first thing? What are you rolling up your sleeve? But your sleeves are rolled up already.
My sleeves already rolled up, so I'm halfway there. Advocacy is the biggest one. One of our biggest missions is the Medicaid reimbursement. Last year, we were able to push a bill through to have child and adolescents receive Medicare rates while they're Medicaid. One of the biggest issues is physicians are really not taking Medicaid because the reimbursements are so low. And this is a population that really needs the most care and the best physicians out there. So we're hoping that now it's able to be for for the adult population. So the physicians will be able to be reimbursed at Medicare rates, which is higher. The other one that's a big one is prior authorizations, which is really a thorn in my side and a thorn not only for physicians, for patients.
Patients, it's a prior. When you hear the word prior authorization, you run to the hills. You're going to go, I'm going to be really bad by the time I get this prior authorization.
It's terrible.
How is this maybe circumvented, short-circuited to what goes on?
So we're asking for simple things, right? We're asking for insurance companies to really have transparency. Right now, if I were to order a medication for a patient, and this has happened to me in the last month, I haven't been able to get a medicine for a patient for 3 weeks. And I keep threatening that I'm going to sue the insurance company. But anyway.
But I think patients do the same thing. They just want to rip our hair out.
It's crazy. So one of the things we're asking, give us exactly what your criteria is for X service or X medication. Can we just go on the website? Can we just look at it? And it's very difficult for us to even see that. We want expedited prior authorization. So
Why?
If I say...
Why?
Exactly. So if I say this person needs an MRI because I'm worried there's a bleed or I'm worried there's something else going on, I want it in 24 to 48 hours tops. I shouldn't have to wait a week. A patient should not have to wait 7 days. So these are the kind of things that we're really asking for.
But why does it happen? I'm the patient, you're the doctor. They're the insurance company.
They don't want to pay for it.
Okay.
That's
not a popular answer, but it's the truth.
It is what it is. I mean, that's, insurance companies will probably come after me.
Her number is no, not at all.
Listen,
we're just putting it on the table as a form of
transparency, right? We're just asking for transparency. So I think that's one of the biggest things. And if it does get denied, and I get it, right? I should be able to talk to a physician at my same level, with my same credentials, and let's discuss the case. Why are you saying you're denying this procedure, or why are you saying you're denying this service? Let's talk about it. And I'll tell you, 9 times out of 10, if not 9.9, they're going to agree to it.
And you have to advocate for yourself, and you have to advocate. And you have to advocate for your patients, and your patients have to advocate for themselves to make things happen.
But if you think about it, if you have a physician that's only allowed to be with a patient 10 minutes because that's all they're going to be reimbursed for, and now they have to be calling insurance companies, and they have to have a whole staff to be doing this, how does that patient feel? Right? It's you're really putting hardship not only on the physician and the staff, but on the patient.
Mm-hmm.
Right? It happened to me yesterday. I was taking my son to an endocrinologist, and there was this poor family there that didn't speak the language, and they weren't able to get the prior auth, and it's heartbreaking. Right? So those are the things that are on the top of my list. That's a long-winded answer.
No, it's good. I'm taking notes, and I have your number.
Yes. So those are my biggest two. I think just really getting more members to the association. I would love to see us in Tallahassee when we go next year. Have a lot of physicians with us, so we can really move the needle and have a seat at the table.
And it's only a 1-year term.
Only a 1-year term. So
as soon as you get your feet wet.
Yes, I put my skates on. And
you're running. I see them. I see them under the table, a little bit in high heels, but okay.
I switch them back and forth.
Let's talk about diversity, equity, and inclusion, and what that means as you promote the DCMA.
Well, I think, we really want to be inclusive. I mean, I think...
what does that mean to you?
So let's take the fact that I'm the only 6th female president. So I want to make sure that we have more women involved, more people of color. We're involved with the Haitian American Association, the Dominican American Association. So there's all these other associations that we really want to bring in to make it ours. We want to be really strong, right? And be very inclusive of all of us. We're going to have a lot of events coming up.
Tell me about a couple of them.
So Women in Medicine.
Good.
I'm very excited about that.
And what can be expected on those networking committee up in?
Right. So the idea with that is really to bring female physicians together, and also to offer something to them, right? So it's not only let's socialize, let's network, which is great, and I love it, and it's very good for longevity, by the way. But I think also to educate them, right? So we had one on contracting and non-competes. Right. So sometimes, we're all in these silos because we're either in academia, or we're private practice, or maybe we're working for a clinic. And so, we're really in these silos, and we don't really get to know, what should I do if this happens? What if I have an issue with administration at my hospital? Where can I go? So we really want to educate them.
So it's really it's like almost a therapy session where you can help each other too, and with information.
With information,
I'm not saying like, oh my God, my husband.
Yes, and wealth management, right? We're looking to do some wealth management courses. How do we invest our money? How do we do these things? Because again, I think we're so into our profession that sometimes we really kind of let other people take care of these things. And I want to empower women to really, advocate for themselves in many areas, not just in medicine.
And let's talk about membership. And let's talk about getting involved. How do people get involved?
Oh my gosh.
Is it just the medical? Is it patients getting involved? Is it both? How does a community come together?
Right. So membership is for physicians, and we also have resident physician level, and we have medical students, and some of them actually sit on our board, which is very cool, right? Because we're kind of, growing the next level of professionals, in what is, corporate, in medicine, right? So having them involved, and how we come together with the community is education and events. So we're hoping to do a few events this year for the community, and we're excited, and we'll keep you posted on those. Absolutely.
It's miamimed.com to get more information.
Absolutely.
And to become part of a community that's really a bigger part of the community, helping its wonderful residents and families.
Right. Yeah. And we also, we do a research symposium once a year for residents. and medical students. And we invite everyone in the community to join. And we had a very successful one this year, which we're very happy about. So we do things like that. We're also involved with, the National Alliance for Mental Illness. We always are at their events, and many more that I just can't name at this, off the top of my head.
Absolutely. And then June 1st was a very big day for you and for the community and for the association. And it was a 1920s theme.
It was The Great Gatsby.
And so perhaps we should go and roll it, as they say. And we could talk and just tell me a little bit. These are people in the community.
Sure. So a lot of them are physicians, family members, and we have a lot of sponsors that were there as well, which is wonderful. We had past presidents there, and some dignitaries were there as well. So it was a wonderful event of bringing the community together, and I was sworn in by my sister-in-law, who's an attorney.
How'd that feel? What was that moment like for you?
That was amazing. Her and I, we've known each other since she's 18. I'm a little bit older than her, just by a few months. I'm kidding.
Of course, me too.
And so it was quite an honor to have her swear me in. And we had, the chief of staff for the clerk of the county court, who gave me a proclamation, which I was so surprised and honored to receive. And we also had the chief of staff for Commissioner Higgins there, and it was really, really wonderful.
What a showing of the community, and so many members in different sects of our community. It's beautiful.
Yes, and Mayor Cava sent a beautiful note for me, and the city of Miami, the mayor as well. So I was quite honored that day. I was blushing.
And you had a wonderful support with you, so it shows testimonial about who you are as a human being, as a woman.
Yeah. So it was nice because I had a lot of physicians that I had worked with in the past that they call me boss still, which I'm not their boss, but they were there, and it was such an honor for them to be there and to share this moment with me, and to have their support, and my family, of course. I can't forget that.
Absolutely.
All 250 of them. No, I'm kidding.
I'm glad I was there with you. It was
so lovely to have you.
It was beautiful to see that happening. So here we are. We're counting down on your year start.
Yes.
Tick, 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 tick.
2 weeks in.
What have you learned?
What have I learned?
Important moments for you.
Yeah.
Or important moments that you want to have. Important moments. Or even important moments that you want to have.
I definitely want to be more involved in the community. I love giving back. I mean, that's kind of one of my priorities, my personal priorities, right, is always giving back to the community that has given me so much, right? So I definitely want to be more involved out there in the community, do more education, huge on education, because I think education is power, and in all aspects of education, right? It's talking about wellness, talking about health, because with health comes mental health, comes physical health, and we need to be talking more about preventive stuff, right? We're always trying, let's cure this, let's cure diabetes, or let's cure hypertension.
So being proactive.
Let's preventive, 100% proactive. Yeah.
And thought for the day?
My thought for the day: drink more water. Get up and move.
I love that whole analogy that you shared with me. Get up and move.
Get up and move. Research shows that if we move every day, because we're also going to suffer from sarcopenia.
What's that?
Sarcopenia is the loss of muscle. And we're all going to suffer from it.
Oh, gosh. Now I had something else to worry about. I really was hoping
not. No, you don't have to. If you just get up and move.
I do.
There's this new research that came out. They're called exercise snacks. Listen, I love it.
Exercise snacks?
Exercise snacks.
But,
I love it.
Wait. Does that, you have to keep your mouth shut, though.
Yeah, there's no eating. So if
I'm not in.
So you stand up and do a high intensity workout. I mean, jump. So it could be jumping jacks for 1 minute as fast as you can. There could be high knee ups, what those are when you just kind of do that. Or squats, like jump squats.
Okay.
For 1 minute, 3 times a day, you increase your total non-mortality rate by 50%.
You mean I can live forever, like they say?
Well, I'm planning to live. I threaten my kids I'm going to live to be 110, so they better get ready.
I'm at 120, so I got you beat.
All
right, we'll be
all right.
Yeah.
So it's about they talk about longevity, but I like to talk about health span, right? So it's not only about living long, but living healthy.
Now we're talking about also mental health on this.
100%.
Exercise is like,
so the research shows, and this is so cool, for lack of a better word. So when we release lactic acid, right, when we exercise, when we use our muscles, so lactic acid is actually absorbed by the brain, and you get brain neural derived factor, which really prevents Alzheimer's and memory disorders and depression and anxiety. So this is amazing. So that's why when I tell people you have to get up and move, you have to exercise, I tell all my patients, they don't all listen to me, I know, but I keep telling them, it's actually good for your mental health and your physical health.
Well, right after this, you and I are going to do some jumping jacks.
Let's do it. One minute.
You'll do more than I will.
1 minute.
All right.
1
minute. And
I'll have to take off my heels, though.
Me too. Me too. I will put on some exercise, my Jane Fonda. But thank you so much. Thank you for being here with me today, Doctor, and also to the DCMA. It's beautiful work that I look forward to following you through. And please come back again as my guest.
I would love that.
And we share as you travel on and you have more experience in moments. I want to hear about them. But first, the jumping jacks, okay?
Jumping jacks.
All right. Thank you.
Okay.
Thank you for being here. And I want to thank you for being here today. I'm Fara Sachs. Until next time, take care of yourselves and each other. Have a great day. And a special thank you to Julian Chang, who now has a second location in Pinecrest. Go visit his boutique for all your clothing and accessory needs.